warm welcome to all to the Cancer Care Series talk show, an initiative of Roche supported by Integrated Health and Wellbeing Council. I am Dr. Asavri Sawant, Public Health Specialist for Team IHW Council, and I would be moderating this show. 19th April is recognized all around the world as World Liver Day. To spread the necessary awareness on this essential topic of World Liver Day, which is treatment of liver cancers and fatty liver diseases, we have an eminent expert here with us today, Dr. Pramod Kumar. Dr. Pramod is the consultant hepatologist at BGS Gleneagles Global Hospital, Bengaluru, and is an expert in this field. Dr. Pramod, we welcome you to the show, sir.
Thank you. Thank you. Welcome.
Let us get started, sir, by informing our audience what are the incidences of liver cancers in India, or hepatocellular carcinoma, as we call it.
Okay. As per the WHO data, it is liver cancer is the fifth most common cancer in the world. We see most commonly in patients in areas endemic to hepatitis B and C infections. Unfortunately, India, again, which is endemic zone for hepatitis B. But we don't have any comprehensive data from India regarding the incidence rates. However, the liver cancer in India occurs in two peaks. One at a younger age group, again between 40 to 55 years, and we see another peak after 60 years. If you look at the cause for liver cancer in Indian patients, in almost 50% of the cases, it is related to hepatitis B infection. And in quarter of the patient, it is associated with hepatitis C infection, which is again prevalent more commonly in northern part of India and northeastern part of India. And in rest of the cases, we see because again due to alcohol consumption. But most commonly, if you look at the overall data, hepatitis B remains most common cause of liver cancer in our Indian population. Yeah.
Thank you so much, sir, for explaining that. So apart from what you have mentioned, are there any other conditions that can cause liver cancer?
Aside from, if you look at the, apart from hepatitis B and C, we have other important risk factors which can cause chronic liver disease. We call it as cirrhosis, which is again a precursor for development of liver cancer. The common causes include again alcohol consumption and the metabolic risk factors, especially in Indian patients, like those who have diabetes, those who are obese, and these patients are at risk of developing non-alcoholic fatty liver disease, which can again a leading emerging risk factor in Indian patients for liver cancer. And apart from these two, we have one more risk factor is intake of aflatoxin contaminated foods. Again, aflatoxin is a toxin which is produced from fungus like Aspergillus flavus and Aspergillus parasiticus. Contamination of foodstuff basically with these fungus can lead to liver cancer in a smaller proportion of patients. And in addition to that, cigarette smoking is also an important co-risk factor for the development of HCC, and also the HIV infection also can increase liver cancer risk. Apart from these are all treatable or reversible risk factors, we call. Apart from these reversible risk factors, some genetic conditions can also lead to development of liver cancer, like iron overload, alpha-1 antitrypsin deficiency, and glycogen storage disease type 1 especially. These are all genetic conditions can lead to the formation of liver cancer in these patients.
Thank you so much for explaining that, sir. So as per what you shared, there could be many different, reasons that can cause liver cancer. Could be any viral hepatitis related infections, could be lifestyle diseases causing liver cancer, and can also be other risk factors which are genetic.
Correct.
Okay.
So in
So
90% of the cases, viral hepatitis remains foremost cause for liver cancer in Indian patients. But one important emerging risk factor is NASH, non-alcoholic steatohepatitis, again related to the obesity, diabetes mellitus, hypertension, those who had dyslipidemia, like a metabolic syndrome. These patients are at risk of again developing liver cancer, even in patients without cirrhosis. Yeah.
and if there is any link between NAFLDs and liver cancers?
Basically, NAFLD, we call it as a non-alcoholic fatty liver disease, is a spectrum. Basically, normally the liver content in fat is less than 5%. If the fat accumulation in liver more than 5%, then we call it as NAFLD. It is again, we divided it into two different entities. One is simple fatty liver. That again denotes only accumulation of fat without any damage to underlying liver cells. And the other entity, again, we call it as NASH, that is non-alcoholic steatohepatitis, where the fat which is accumulated within the liver cells can lead to damage of these liver cells and also can cause serious liver damage, including cirrhosis. When these patients develop cirrhosis or severe fibrosis, then they are at risk of developing liver cancer. Okay, but most of the patients we see a simple fatty liver without any damage to the underlying liver cells or liver tissue. And but the most important risk factor is development of NASH. Again, we commonly see it in patients with those who have metabolic syndrome phenotype, like as I already mentioned, those who are obese, diabetes mellitus. These patients are at risk of again developing this liver inflammation, leading to development of liver cancer.
How can one develop NAFLDs? And what to do if someone develops NAFLDs?
Okay, basically NAFLD, as I already mentioned, is a metabolic liver disease. Basically, it's again related to the various metabolic derangements, leads to the accumulation of fat inside the liver. Okay, we commonly almost, if you look at the data in Indians, we see NAFLD in 30% of the population. Again, if you look at the patients with diabetes, NAFLD is present in almost 60%. But not all patients develop liver disease. Only few patients, those who have other risk factors, are usually at risk of developing liver disease. Most important thing is the adopting a healthy lifestyle is the most important thing to manage a patients with NAFLD. We advise these patients to lose weight. Usually the ideal BMI for Indian patients is somewhere between 18.5 to 23.5 kg per meter square. Losing more than 10% of body weight usually can remove some amount of fat from the liver. Also, the weight loss can improve the NASH, that is the liver damage, which is occurred due to the fat accumulation. Most important is to lose weight and to have a healthy eating habits, like try to have a balanced diet, which is rich in fruits, vegetables, and lot of proteins and carbohydrates. Again, but low in fat and also refined sugars and salt. And you can have water instead of having sweet drinks. Again, sugar carbonated waters like that. And third important thing is to exercise regularly. Like at least one should exercise for 30 to 45 minutes in a day, at least for 5 to 6 days in a week. The exercises we suggest is to go for a brisk walking, or you can do a stationary cycling or swimming. And even these are the exercises, usually we call it as a moderate intensity exercises. These can help in lose a certain amount of weight. And the other common risk factor we see in these patients is smoking and also the drinking habits. Usually, again, if you smoke in the, if you have fatty liver and if you smoke, then you are at risk of developing the NASH, and also you are at risk of developing liver cancer. And other many patients ask us whether to drink or not in the presence of fatty liver disease. Usually, the fatty liver disease is not caused by the alcohol consumption, but if you drink in the presence of fatty liver disease, usually it will make it worse. Usually, they are at risk of again developing liver fibrosis, liver cirrhosis at the earliest age, and also they are at risk of developing liver cancer per se. So, most three important things in a patient with fatty liver we suggest is to lose weight and have a healthy diet and to exercise regularly and avoid alcohol and smoking. These are the things we suggest for fatty liver patients.
Thank you so much, sir. So many people associate alcohol with liver diseases and are
Correct.
not really aware that smoking can also aggravate liver problems and can cause diseases such as NAFLDs. So, as you rightly recommended, it is very important for people who have been developing liver, fatty liver diseases to stop all these, practices of consuming alcohol or smoking, so that the problem does not aggravate even more. So let us talk on to liver
Yeah.
cancers. So, what are the symptoms of liver cancers that people should be able to know, so that if any of these symptoms arise, they can go to their doctor and get checked as early as possible?
Yeah, but most of the patients with early stages of liver cancer, usually they won't be having any symptoms per se. Usually we see symptoms in patients with advanced stage. That's why we recommend screening again in high-risk population. The common symptoms usually patient experiences are most important, like loss of appetite is the one, and also the unexplained weight loss. And sometimes many patients complaints of pain in the right upper part of the abdomen. And also many patients notice worsening of liver disease symptoms like swelling in the abdomen, again swelling in the legs, and also some patients notice yellowish discoloration of eyes, skin, and also many patients notice back pain and vomitings. Sometimes many few patients have had a blood vomiting kind of thing. Commonly in early stages, usually patients don't experience any symptoms. Again, it depends on the stage of the disease. Usually these are the symptoms we see it in patients with advanced stage disease.
Thank you so much for sharing that. So, sir, can liver cancers be prevented? Is it possible? And if so, then what measures should be followed so that people can make sure that their lifestyle habits or something that they are doing that is well under control does not lead to liver cancers in future?
Yeah. Liver cancers can be prevented by usually reducing exposure to known risk factors. As I already mentioned, alcohol is the most important risk factor in Indian population. Stopping completely alcohol intake is the one. And for viral infections like hepatitis B and C, for hepatitis B, we have a effective vaccination schedule that now it is recommended for every newborn child. It is mandatory for to take that hepatitis B vaccination. For hepatitis C, we have very wonderful drugs in the last decade. These drugs can cure hepatitis C in almost 95% of the cases. In coming to the fatty liver, if you look at the in fatty liver patients, as I already mentioned, most important thing is to lose weight, have a healthy diet, and to exercise regularly. Usually, with these precautions, at least even fatty liver can be reversed, and development of NASH can be avoided in these patients. Yeah. Vaccination is the one thing usually that changed the that has reduced the incidence of hepatitis B related liver cancer in Indian population. But as I already mentioned, now more commonly we see with liver cancer in patients with NASH, again related to our lifestyle changes. Yeah.
Thank you so much, sir, for so nicely explaining us all these measures. So, sir, you spoke about that in early stages, liver cancers are usually, left undetected.
Correct.
So, how is liver cancers detected? Can you please help us understand that?
Okay. Usually we suggest screening. Basically, screening is done. The patients who are at high risk of developing of liver cancer. Usually, these patients will not have any symptoms. We just suggest screening in these patients. Screening is recommended in patients those who have hepatitis B, hepatitis C related liver disease. Again, those who have a family history of liver cancer in the background of NASH or NAFLD. These are the patients usually we recommend screening, and also those who have liver cirrhosis, again a precursor for development of liver cancer. We recommend to these patients to undergo scanning, like ultrasound of the abdomen, and also we do blood test. We have a blood marker, call it as alpha fetoprotein. Again, these two tests are recommended. We do it in every 6 monthly in this high risk population. If anything is there, then at least we can detect these patients at earlier stages. Once patients is diagnosed at the early stage, they have better outcomes. Usually, we can in early stages of the liver cancer, we can cure these patients with various treatment modalities. Yeah.
Thank you so much, sir. So, as you shared that the ultrasound is some of the scans that are recommended, and blood test and some blood markers, biomarker tests. So, sir, is liver biopsy is also recommended in cases of liver cancer? If so, then when it is required?
Usually, as compared to the other cancers, liver biopsy is not routinely recommended in patients with liver cancer. Diagnosis is mainly based on the blood marker and also the characteristics. We see it in the imaging, like we do contrast CT, contrast computed tomography of the abdomen. We call it as a CT, or MRI scan of the abdomen. In these scans, we look for the specific characteristics. If it is the characteristics of that cancer is fitting into the liver cancer, then we usually don't do liver biopsy. But in certain patients, those usually the most of the cancers in 90% of the patients, cancers occurs in the background of liver disease, like liver cirrhosis. In these patients, we usually don't do liver biopsy, but in 10% of the patients, liver cancers can occur even in the absence of background liver disease. In these patients, we usually tend to do liver biopsy or the biopsy from the cancerous area to confirm the diagnosis. Sometimes even the liver cancer can coexist or can mix with other types of cancer like cholangiocarcinoma. It's a different cancer arises from the bile ducts. Again, liver cancer arises from the liver cells. When sometimes these two different kind of cancers coexist, and in those kind of cases, we usually do liver biopsy and confirm the diagnosis. In a routine cases, we usually don't do. Only in 10% of the cases, we do liver biopsy again to confirm the diagnosis.
Thank you so much, sir, for explaining that. Again, can you please help us explain what are the different blood tests that are done to diagnose the dysfunctions in liver? Talking about different liver function tests that are recommended, explaining a little about kidney function tests if required, other blood chemistry tests, so that our audience understands how do these would help in detection.
Usually, as I already mentioned, liver cancer often develops in livers which are already damaged by hepatitis or the cirrhosis. Usually, we recommend first test we recommend is liver function test. Usually, that again reflects whether the liver is functioning well or not. It again contains a panel of various enzymes and also the protein albumin levels. And other function, other tests we do in liver cancer patients is alpha fetoprotein. Again, it is elevated only in 70 to 80% of the patients with liver cancer. In 20% of the patients with liver cancer, usually it will be within the normal limits. Again, this test can be used and again an idea about how well the treatment is working. Even in follow we do repeat this alpha fetoprotein test, and also we check for various infections like hepatitis B and C, and also we check for liver function tests like blood clotting tests, because damaged liver might not make enough of clotting factors, again, which could increase risk of bleeding, like varicose bleeding, or when you do a procedure, then there are risk of bleeding. And also we do kidney function tests because often patients with liver cirrhosis develop kidney related problems also. And we do complete blood count. Usually these patients will have low platelet count and also low WBC count related to cirrhosis and also the splenomegaly. And we do other tests like calcium, blood glucose levels. Again, these are all to check whether liver is functioning well or the liver cancer is affecting other organs.
Thank you so much, sir. So if somebody does develop liver cancer, apart from the signs, what are the different complications that liver cancer opposes on the person's health as well as the well-being of the people around, the caregivers?
Okay. Usually, since the liver cancer develops in the background of cirrhosis, these patients develop worsening of liver functions, like the worsening of the water accumulation in the abdomen. They can develop varicose bleeding, and also they can develop jaundice. These patients can have blockage of various blood vessels like portal vein, hepatic vein, or various major blood vessels like inferior vena cava. And other common complications is development of hepatic encephalopathy. If the size of liver cancer is large enough, they can rupture and lead to life-threatening bleeding inside the abdomen. Again, these patients suddenly they develop abdominal pain, and they develop hypotension and all. And sometimes the liver cancer spreads to other parts of the body, like lungs, bones, backbone, and also the brain metastasis also is well known. When many patients do complain of back pain or breathlessness because of the spread of liver cancers to the other parts.
Let us now move on to discussing the treatment options for liver cancer. And is the treatment of liver cancer same as other cancers?
Treatment of liver cancer depends on the stage of the disease and also the how well liver is functioning and also the general performance status of the patients. These three factors we consider before the treatment. And depending on these factors, we divide we classify liver cancer into various stages. If the cancer is limited to liver, then there are various treatment options like surgery, radiation therapy, or ablation, or many catheter-directed therapies are there. Once the cancer is spread to various other organs, or if it involves blood vessels, and the treatment options are very limited. And coming to the treatment options of liver cancer, if it is in the early stage, limited to the liver, or if it is of a small size, and the liver is functioning well, surgery is the best option. In surgery, they will remove the entire tumor, and if the liver function is not well, if the background, if the patient has background liver cirrhosis, in early stages, we do recommend liver transplant surgery in these patients. If the size is very small, surgery is recommended. If the background liver is not functioning well, we do recommend liver transplant surgery. If the size is little big, or if it involves any blood vessel, but limited to the liver, then we have other treatment modalities like the localized treatment options like the eating of cancers, like with radiofrequency ablation, or we can freeze these cancer cells using cryoablation modality, or we can inject alcohol into these small tumors that can again directly kill the cancer cells, or we can inject certain chemotherapy medications directly into the liver cancer area through the artery supplying that cancerous area. We call it as chemoembolization. Or we can place the radiation beads directly into the cancerous area. We call it as transarterial radioembolization. These are all localized treatment options for liver cancer. Again, the type of treatment modality depends on the size, location, and also the background liver function test. We decide depending on the stage of the disease. In radiation, we have three types of modalities. We call it as external beam radiotherapy, or we can we can place beads which contain radiation directly into the liver. And coming to the patients with advanced liver cancer, in patients with advanced stages of liver cancer, the treatment options are very limited. It's again very we treat these patients with palliative intent, like they're prolonging their survival. In this, we have many tablets, and we also have newer modalities like immunotherapy, which targets our immune system to fight against the liver cancer. This is again an advanced modality. Conventional chemotherapy, we don't routinely use it in patients with liver cancer. Either we use tablets, again, which specifically immunotherapy, which again targets our immune system. And if patients has the very poor liver function and also advanced stage liver cancer, we usually suggest them to go for a palliative care. Again, palliative care is a specialized care, again, that mainly focuses on the pain relief and other symptoms usually. Okay.
Can liver transplant completely cure liver cancer? And is it the last resort?
As I already mentioned, the type of treatment modality depends on the stage of liver cancer. In early stages, we do suggest various treatment modalities like surgery or burning this liver cancer tissue like radiofrequency ablation and all. But again, these patients are at risk of having recurrence. Again, the chance of cancer coming back is a little high as compared to the other modalities, because our the liver cancers occurs in background of already damaged liver. Usually, if you treat at one area, they are at risk of developing cancer at a different place in the liver itself. Since the liver transplantation is the one thing where in transplantation procedure, we remove both the tumor and also the background damaged liver. Liver transplantation is recommended only in early stages. Again, it depends on the size of the tumor. If the tumor size is, liver cancer size is less than 5 centimeter, and we call it as a Milan criteria. If the tumor size is fitting into that criteria without any blood vessel involvement or without any extra hepatic spread, we can consider liver transplantation in these patients. If you do liver transplantation, the chance of survival is around approximately 80% at 5 years, and also close up to 50 to 60% at 10 years. And also the chances of recurrence are very less if you do it when the patient fulfills that criteria. If we don't do liver transplantation, only if we treat them with various therapies like chemoembolization and all, the chance of recurrence is very high in these patients. And also, these patients are at risk of developing symptoms related to liver cirrhosis, already damaged liver. Liver transplantation is the one surgery which can takes care of both liver cancer and also the damaged liver, that is liver cirrhosis. It is a standard procedure now all over the world, which is a recommended procedure for liver cancer. Again, it in the early stages, not in the advanced stage. If you do transplant in the advanced stage, again, they are at risk of having cancer or even after transplantation. That's why we do recommend transplantation in the early stage. It is not like usually it is not like a last resort.
Thank you so much, sir, for such an insightful session and full of information, wealth of knowledge that our viewers got. We would also like to thank Roche for this brilliant initiative for spreading awareness on liver cancers. Thank you so much. Thank you.
Thank you, Dr. Thanks.
Thank you.